was really important to me to take the difficult things that I've experienced in life and use it to kind of transform those hard things into something that helps other people and makes a difference. I'm Susan, and I'm a 2-time cancer survivor and a patient advocate. I was 17 the first time that I was diagnosed. My entire senior year of high school, I knew something was wrong. They did a chest x-ray and saw a big mass in the mediastinum area in between my lungs, and it was actually in the pericardium of my heart as well. Then I looked at my symptoms, and I'll never forget, at the top left corner of the page, it said cancer. It was scary because I wasn't really sure. After radiation treatment, my tumors had shrunk and they were gone. I saw the cancer doctors, the oncology doctors, for 5 years. So at 22, I was told, go live your life. I was never told that I needed to be followed by an oncologist after, never told that I needed to see a cardiologist. The cancer as a teenager did kind of move farther and farther back into the rearview mirror. It was actually a few decades after, and I started having some symptoms, and I went to see a cardiologist locally here, and he told me that I had severe aortic stenosis. And then he said it was caused by the radiation treatment that saved my life when I was a teenager.
Depending on the cancer treatment, there's essentially a universal adverse effect on the cardiovascular system to some degree. Our understanding of the development of cardiovascular disease in cancer patients has significantly grown over the past few decades.
The medical research that I read said that it's actually very common to happen decades after treatment.
They've done studies through St. Jude in their registry of survivors of childhood cancer, and we're finding that this patient population is up to 10 to 20 times more likely to have these conditions in their 30s and 40s, which is almost unheard of to some degree in the general population.
Aortic stenosis can be fatal if it's not treated. The cardiologist said that I would probably need to have a heart valve replacement within about 6 months. And he did mention that there was a new treatment for valve replacement. I went to this major university hospital and saw their heart team, and it consisted of an interventional cardiologist who does TAVR. He told me that I was actually a candidate for TAVR, and I remember thinking I had won the lottery.
Not only is the TAVR procedure safe, but the outcomes are essentially equal between open chest surgical repair and a minimally invasive valve repair.
The difference between TAVR and cancer treatment is amazing. 10 days after my valve replacement, I was home.
No open chest procedure, no big staples or stitches type of thing, but the recovery time and process is pretty minimal. It's a remarkable procedure.
I really felt like I'd gotten my life back. 2.5 years after I had to have my routine mammogram, I found out I had breast cancer. I learned that the treatment for HER2-positive breast cancer is Herceptin, and that carries a risk for heart failure. So I was really concerned and worried about that. Fortunately, I learned about a completely new specialty called Cardio-Oncology.
The field of cardio-oncology can really shine and work collaboratively with oncologists to improve the overall care of the patients on the short term and the long term. It's equally important to promote cardiovascular health in cancer patients in primary care settings and oncology settings. So if we can minimize the likelihood that the cardiovascular system impacts cancer treatment, we know patients do better overall long term. Now we actually have the tools in our toolkits to make that difference and to positively impact the treatment of these patients long term.
It is really important to be your own advocate and to watch your body and what your body's telling you through symptoms and to not ignore them. And that includes all aspects of yourself, mentally, emotionally. I'm also the Director of Patient Engagement for Heart Valve Voice US. We have monthly support calls, and it's a place where patients can get support from one another. The sense of connection that people develop almost instantaneously is miraculous and wonderful. It's the small things. It's the things that don't cost anything that bring real joy and peace and contentment. For me, it's nature. It's meeting a friend for coffee. It's working in my garden. And it's helping other people through my advocacy work. Those things really give me a lot of joy. Now I'm just enjoying life, having balance, working with patients, and I'm enjoying traveling. It's something I love to do and something I hope to continue doing for a long time.